Welcome to Boxed in Health, where knowledge and wellness converge, sparking transformative journeys to a better you. Today, we uncover the topic of asthma. Asthma is a condition where your air passages become narrower and swell, possibly leading to increased mucus production. This narrowing and swelling can cause difficulties in breathing, leading to symptoms like coughing, a whistling sound while exhaling, wheezing, and a feeling of breathlessness. While some individuals experience asthma as a minor inconvenience, for others, it can become a significant issue that disrupts daily life and even poses a risk of life-threatening asthma attacks. Although asthma cannot be completely cured, its symptoms can be managed effectively. Since asthma symptoms can change over time, it's crucial to collaborate with your healthcare provider to monitor your signs and symptoms and make necessary adjustments to your treatment plan. Asthma symptoms can vary significantly from person to person. Some individuals may experience infrequent asthma attacks, only have symptoms during specific situations like exercise, or constantly contend with symptoms. Common signs and symptoms of asthma encompass 1. Shortness of breath. 2. Tightness or discomfort in the chest. 3. Wheezing when exhaling, which is particularly noticeable in children. 4. Difficulty sleeping due to shortness of breath, coughing, or wheezing. 5. Coughing or wheezing episodes exacerbated by respiratory infections like a cold or the flu. Indications that your asthma might be worsening include 1. Frequent and bothersome asthma signs and symptoms. 2. Increasing difficulty in breathing, as measured by a device called a peak flow meter that assesses lung function. 3. The need for more frequent use of a quick relief inhaler. Furthermore, some individuals may find that their asthma symptoms worsen in specific circumstances. 1. Exercise-induced asthma, which can be more pronounced in cold and dry air. 2. Occupational asthma triggered by irritants at the workplace, such as chemical fumes, gases, or dust. 3. Allergy-induced asthma, provoked by airborne substances like pollen, mold spores, cockroach residue, or particles from pets like skin and dried saliva, pet dander. The reasons why some people develop asthma while others do not remain somewhat unclear, but it is likely influenced by a combination of environmental and inherited, genetic, factors. Asthma triggers can vary widely among individuals and may involve 1. Airborne allergens. These can encompass pollen, dust mites, mold spores, pet dander, or even tiny particles of cockroach waste. 2. Respiratory infections, such as the common cold. 3. Physical activity. Exercise can sometimes provoke asthma symptoms. 4. Cold air. Exposure to chilly air can trigger asthma in some people. 5. Airborne pollutants and irritants, like smoke, which can exacerbate symptoms. 6. Certain medications. This includes beta blockers, aspirin, and nonsteroidal anti-inflammatory drugs such as ibuprofen and naproxen sodium. 7. Strong emotions and stress. Emotional states can also play a role in asthma flare-ups. 8. Sulfites and preservatives. Some foods and beverages, such as shrimp, dried fruit, processed potatoes, beer, and wine, may contain substances like sulfites that trigger asthma in susceptible individuals. 9. Gastroesophageal reflux disease, GERD. This condition, characterized by stomach acid backing up into the throat, can contribute to asthma symptoms. Several factors are believed to heighten your likelihood of developing asthma. These factors include 1. Family history. Having a blood relative with asthma, like a parent or sibling, can increase your risk. 2. Other allergies. If you have additional allergic conditions, such as atopic dermatitis, causing red, itchy skin, or hay fever, resulting in a runny nose, congestion, and itchy eyes, your chances of developing asthma may be elevated. 3. Weight. Being overweight has been linked to an increased risk of asthma. 4. Smoking. Both active smoking and exposure to secondhand smoke are associated with a higher likelihood of developing asthma. 5. Environmental factors. Being exposed to exhaust fumes and various types of pollution can also contribute to asthma risk. 6. Occupational exposure. Certain occupations, like farming, hairdressing, and manufacturing, may involve exposure to chemicals that can trigger asthma, potentially increasing the risk for individuals in these fields. Complication. Asthma complications include signs and symptoms that interfere with sleep, work and other activities. Sick days from work or school during asthma flare-ups. A permanent narrowing of the tubes that carry air to and from your lungs, bronchial tubes, which affects how well you can breathe. Emergency room visits and hospitalizations for severe asthma attacks. Side effects from long-term use of some medications used to stabilize severe asthma. Proper treatment makes a big difference in preventing both short-term and long-term complications caused by asthma. Prevention. While asthma can't be entirely prevented, you and your doctor can create a practical plan to help you manage your condition and reduce the likelihood of asthma attacks. 1. Follow your asthma action plan. Collaborate with your healthcare team to create a detailed strategy for taking your medications and handling asthma attacks. It's crucial to adhere to this plan consistently. 2. Regular monitoring and treatment. Asthma is an ongoing condition that requires regular monitoring and treatment. Taking an active role in managing your treatment can provide you with a greater sense of control over your life. 3. Get vaccinated. Staying up to date with vaccinations for influenza and pneumonia can help prevent these illnesses from triggering asthma flare-ups. 4. Identify and avoid triggers. Learn what outdoor allergens and irritants, such as pollen, mold, cold air, and air pollution, can exacerbate your asthma. Take measures to avoid exposure to these triggers. 5. Monitor your breathing. Recognize early warning signs of an impending asthma attack, such as mild coughing, wheezing, or shortness of breath. Use a home peak flow meter, as instructed by your doctor, to regularly measure and record your peak airflow. This device gauges how effectively you can exhale. 6. Early identification and treatment of attacks. Acting promptly when you notice a decrease in peak flow measurements or other signs of an impending attack can prevent the attack from becoming severe. Follow your action plan, take prescribed medication, and discontinue any activity that may have triggered the attack. If your symptoms persist, seek medical assistance as directed in your plan. 7. Medication adherence. Always take your medications as prescribed and consult your doctor before making any changes, even if your asthma appears to be improving. Bringing your medications to each doctor visit allows your healthcare provider to ensure you are using them correctly and taking the appropriate dosage. 8. Watch for increased use of quick relief inhalers. If you find yourself relying frequently on your quick relief inhaler, such as albuterol, it indicates that your asthma is not adequately controlled. Schedule a consultation with your doctor to discuss potential adjustments to your treatment plan. If you enjoyed today's video, don't forget to like, share and subscribe for more informative content like this. Thanks for watching. See you again in another video.